Hello, and welcome to this course on cardiovascular disease. Let's start with the very basics. What is cardiovascular disease? Cardiovascular disease is a collective term used to describe different diseases of the heart and blood vessels. Cardiovascular disease, otherwise known as CVD, is the leading cause of death worldwide. Today, we are going to learn everything we need to know to help our patients monitor and manage their symptoms. We will also cover how we can play a vital role in assisting our patients to improve their overall quality of life. Topics we are going to cover in this course include understanding CVD, the risk factors for CVD, causes, symptoms, and care of patients with different types of cardiovascular disease, potential complications of CVD, oxygen precautions, and how to recognize when CVD is an emergency and how to respond calmly, quickly, and appropriately. To kick things off, let's break down the word cardiovascular disease. It's a bit of a mouthful, but basically, cardio means heart and vascular means blood vessels. So we know that if someone has cardiovascular disease, or CVD, that they have an issue with either their heart or blood vessels. When we talk about cardiovascular disease, it's important to know that we're not just talking about one single disease. CVD is a collective term that is used to describe any number of different diseases which relate to the heart or blood vessels. These diseases can include coronary artery disease, arrhythmias, heart valve disorders, heart failure, cardiomyopathy, ischemic heart disease, and endocarditis. You may have heard of some of these terms already, or they may be completely new to you. Don't worry too much about remembering these at this point. We will cover each of these in more detail throughout the course. The main takeaway from this introductory lesson is simply that cardiovascular disease is a term which covers many different types of diseases which relate to the heart or blood vessels. Now that we understand what cardiovascular disease is, let's talk about some of the different risk factors that might make someone more likely to get cardiovascular disease. Let's take a moment to think about a person you may know with cardiovascular disease. What sort of things did you notice about their lifestyle or their medical history? Maybe that person was a smoker. Maybe they followed a poor diet. Maybe they weren't very active. All of these lifestyle habits are risk factors for cardiovascular disease. That is, they increase a person's chance of having CVD. Other important risk factors include poor managed high blood pressure, diabetes, obesity, increased stress, family history of heart disease, alcohol or drug abuse, and high cholesterol levels. Another highly relevant thing that influences someone's chances of getting CVD is their age. As we age, our bodies change. Did you know, as our heart beats over time, they become larger and eventually weaker? This also happens with other muscles in our body too. With time, other parts of our body start to slow down as well. For example, how we break down and store fats and minerals changes, which can cause a buildup of these minerals and fats and can cause hardening of the arteries, otherwise known as atherosclerosis. And let's not forget about other signals in the body that work to keep things like our blood pressure stable. When these signals no longer respond like they used to, we are likely to see high blood pressure. While none of us can avoid getting older, we can certainly help our patients to live a healthier lifestyle and actually prevent these risk factors. Isn't that amazing? Risk factors, which you also might not have considered, include biological sex and poor dental hygiene. Let's take a look at some interesting facts here. Did you know that biological men, that is, people who are born male, and biological women who have experienced menopause have a greater chance of having cardiovascular disease? While research shows that in men, it is often due to lifestyle factors like higher alcohol intake, smoking, and poor nutrition, there are other factors at play too. We know that men and postmenopausal women do not adapt to both physical and mental stress well. This can cause an increased release of stress hormones, high blood pressure, diabetes, and buildup of cholesterol and fats, which we know are all risks of CVD. The great news is that all of these sex-related risk factors can largely be prevented. You, as a caregiver, will be in a great position to assist your patient make positive choices by the end of this course. Poor dental hygiene is also a risk factor for cardiovascular disease. Who would have thought, right? The two seem so unrelated. However, if the teeth or gums become infected, bacteria in the mouth can enter the bloodstream and make their way to the heart. This bacteria can grow on valves in the heart or in other areas of the heart's muscle layer. This disease is known as endocarditis. It goes without saying that brushing teeth, flossing, and regular visits to the dentist do more than just give you a gorgeous smile. We'll talk a bit more about specific diseases soon, but first let's recap some of what we've learned. In these lessons, we have learned what cardiovascular disease is, we have touched on some of the different diseases which can contribute to CVD, and we now know what risk factors can lead to or cause CVD. Before we move on, let's take a look at a scenario to put our learning into practice. Jerry is an 87-year-old man. He has high blood pressure, but manages it well by taking his regular medication, staying active, and eating a well-balanced diet. He has a social drink every now and then with some of his friends, but otherwise, he's well. Jerry's wife, Lucy, is 78 years old. Lucy also has high blood pressure, stays active, and eats well. However, she has some memory loss, which can cause her to become quite distressed at times, and she often forgets to take her medication. Lucy doesn't drink alcohol, but has smoked for 55 years and only recently stopped when she and Jerry moved into a new residential home. As we can see, both Jerry and Lucy have multiple risk factors for CVD. So let's zoom in on those. Jerry is male. He is older, has high blood pressure, and he drinks occasionally. However, Jerry manages his blood pressure by taking his medication regularly and is otherwise healthy. Lucy's risk factors are her age, that she is a postmenopausal woman, she has smoked for a long time, has high blood pressure, and experiences quite a lot of stress due to her memory loss. In addition, her blood pressure is not well managed. As a healthcare worker, who do you think would be more at risk of developing cardiovascular disease? If you said Lucy, then you are 100% correct. We know both Lucy and Jerry have multiple risk factors. However, Lucy's are not well managed. Her memory loss leads her to forget her medication, and she also experiences quite a lot of stress. Both of these factors would contribute to her high blood pressure and put her at risk of other diseases which can cause CVD. If you have a patient like Lucy, what should you do? Well, as a caregiver, you should report your observations and concerns to your agency. You might also discuss with the agency nurse having the care plan updated to include verbally cueing Lucy to take her medication, providing some activities which might help her to manage her stress like walking, painting, knitting, reading, really any activity which helps her to feel relaxed. Your observation and help can really make a difference. As a reminder, some of the risk factors of CVD include poorly managed high blood pressure, diabetes, obesity, increased stress, family history of heart disease, alcohol or drug misuse, high cholesterol levels, age, biological sex, and dental hygiene. We know that many of these risk factors are preventable, especially those related to lifestyle. As caregivers, we are in the perfect position to help our patients. Join me now in the next lessons where we do a deeper dive into some specific diseases and what we can do to encourage our patients to manage their symptoms and maintain overall health.